Sonographers, I'm back. Let's get into soft markers. So soft markers are ultrasound findings that do not represent a structural anomaly, may be a normal variant, but have been associated with an increased risk of fetal aneuploidy. These soft markers typically are identified at the time of the second trimester anatomy scan. So here is an echogenic focus in the left ventricle, or it could be in the right ventricle, and you want to make sure it's as equal in the echogenicity to the bone and show it in two planes. Here's an image of fetal pylectasis at about 16 to 27 weeks. The number should be 4 to 7 millimeters, and if it's past 28 weeks, it should be 7 to 10 millimeters. Here's a short femur, and once you measure that, or a short humerus, if it's less than 5th percentile, that's a soft marker. Here's an image of echogenic bowel. If the bowel is as bright as bone, even with your gains down, that's considered echogenic bowel. Here's a choral plexus cyst. It may be any size, may be bilateral or unilateral, and it's basically an anechoic cystic structure within your choral plexus. Here's some more imaging of this. You can see it's bilateral on the left side there. Here's another great image of a choral plexus cyst, unilateral. Here's another great image, same thing. Thanks to Radiopedia for providing these great images on their website. The next one is an increased nuchal skin fold, and the right image is normal. The left has an increased thickened nuchal skin fold, which is greater than 6 millimeters. Here's absent nasal bone, and you can see clearly there's no nasal bone there. The little arrow is pointing to where the little nasal bone should be completely out, and here's first trimester scan of absent nasal bone. We can view that on our 12-week scans of the nuchal translucency. Here's single umbilical artery. Your cross-section view shows one artery, one vein, and that will be your confirmation, which is right here in this image here. And you can also show it in transverse as well, but basically your color Doppler will show you that there is one artery. And again, thank you for tuning in. And this video is limited to the sonographic findings only. Soft markers and other clinical considerations were not included in order to maintain a clear and ultrasound focused presentation. Thank you very much.